Iris signs and reaction fields. This is a really fun chapter where we begin to learn to read the iris. Iris signs are markings in the iris that tell the iridologist something about the health condition or genetic potential of the various organs and systems of the body. Iris signs are based on the colored pigmentations of the eye, as well as the deviations or separations of the fibers in the iris stroma. The location of an iris sign is called a reaction field. Let's learn how to identify the iris signs and reaction fields in which they are located. Now I'd like to talk with you a little bit more about reaction fields. We're going to be learning iris signs in this chapter, and so I want you to understand that the organs are not actually in the iris of the eye. What we call those areas are reaction fields. The area that the organ is reacting upon, for example, the heart reaction field, the thyroid reaction field, the kidney reaction field. All areas of the iris, when there's a marking there, will be a reaction field, the liver reaction field, the pancreas reaction field. Now we're going to go over iris signs and their descriptions. There are very interesting signs that we can see in the iris of the eye. And in this iris, we're going to be looking at radial fibers. Remember, we said that each fiber of the iris, every single fiber, is a blood vessel, and each blood vessel is covered with a sheath. Each one of those fibers is called a trabecula. More than one trabecula is trabecula with an E. When those fibers begin to separate, those are called rarefications of fibers or rarefaction of fibers. We can see here at 9 o'clock in the left iris a separation of fibers, which is called rarefication or rarefaction. That simply means that there's starting to be a separation. Remember, density equals resilience or resistance. So in this area, there's a lack of ability for the body to resist illness, in this case, in the thyroid reaction field. The next sign that we're going to learn is called lacuna. A lacuna is actually a hole in the fabric of the iris. More than one lacuna is spelled with an E on the end, and some people even use an S, and that's okay too. In these eyes, we're going to look at here a closed lacuna that actually has a border all the way around it. So if you look at that lacuna, there's a border all the way around it. Here we have another lacuna with a border around it. All closed lacuna have a border completely around them. So closed lacuna are openings in the fabric of the iris with a border completely around them. Open lacuna are lacuna or holes in the fabric of the iris that have a border around three sides. And those can be open on one end or both ends. So the difference between a closed lacuna and an open lacuna is that a closed lacuna cannot get toxins out or nutrients in as well as an open lacuna that is open on one side. So a closed lacuna is a more genetically deficient area than an open lacuna. But with an open lacuna, they can get toxins out easier, and sometimes they may be feeling it in the moment more so than an area of a closed lacuna. Now we're going to talk about crypts. Crypts are areas in the iris that are small lacuna with borders all the way around them. We see these little crypts, usually inside and outside of the collarette. They're usually very dark and separated to the lowest levels or the posterior epithelium layer. So just because they're small doesn't mean that they're not long-term potentially serious signs, because the darker they are, the longer they have been in the genetic path or pattern of that person, and there's more of a genetic deficiency there. Defect signs. Defect signs are even smaller than crypts, and those defect signs look like little holes in the fabric of the iris. So here we see a defect sign that's very tiny, and it's smaller than a crypt, but it's dark, so it's also a genetically serious potential, and it looks almost like someone took a pin and poked a hole in the fabric of the iris. So you want to look at where crypts are located, where defect signs are located, and where lacuna are located. So you can use your iris chart to see what organ areas they are located in. A cord is a white fiber in the iris of the eye, and white fibers that are pinched together in a little bundle, such as this, and they simply mean that there's a lot of agitation and irritation in the iris in that area. Remember, white and light fibers that are raised show us a potential for inflammation and discharge and irritation. Reflexive signs. Reflexive signs are signs that are raised and white and wavy. Reflexive signs also show irritation, agitation to that area, possible discharge, possible pain. The next term we're learning is called perifocal lightening. I've mentioned it before, and here is an example. We have a light cord beside a very dark open lacuna. Light signs right beside dark signs show from the light sign a lot of irritation, possible fever, possible discharge, beside a very dark sign that has a very difficult time dispelling toxins. So it's almost like a volcano trying to erupt. There will be an opportunity for sometimes that person, in this case the lung area, to be trying to cough up mucus and have a difficulty doing so. Remember, these are genetic signs. Transversals. Transversals are signs that we see that go askew or in a diagonal direction from the radial iris fibers. Here we see a transversal, and it's going askew from the radial fibers. The normal radial fibers move all the way out from the pupil border to the iris edge. But transversals go in a diagonal line where the fibers are going askew. And transversals basically mean irritation to that area. There's a potential for pain or discharge or irritation in that area. Vascularized transversals. Vascularized means that the sheath has worn off of that fiber. And we can have vascularized radial fibers, vascularized transversals. But when the sheath has worn off and the blood is showing through, that's an even greater sign of irritation, possible pain in that area. Osseous netting. Osseous netting is revealed in the outer portion of the iris, out here, where we see tiny little crisscrosses in the outer, sometimes 5th, 6th, and 7th zone. And these little crisscrosses in these areas like this show us a tendency, a genetic potential for arthritic symptoms, aching, in the bones, aching sometimes in the muscles. Rooftop transversals. Rooftop transversals look like little rooftops. We see those here. They're going in a rooftop fashion. They're going in a diagonal way to the radial fibers. All transversals, and especially rooftops, mean irritation in the areas that you see them in. The spleen-heart transversal is a very important sign, and it moves all the way through the spleen reaction field toward the heart. It doesn't necessarily have to go to the heart. In this case it does. But it's called a spleen-heart transversal, and it is an indication of a heart deficiency. Radial furrows. Radial furrows are very interesting furrows that are actually grooves that go sometimes from the pupil border to the iris edge, or they can also go from the pupil border out just into the collarette. So we can have very short radial furrows. This one's rather short. And then some that are a bit longer, some that break through the collarette, and some that go all the way out to the iris edge. Radial furrows are grooves, and they show a potential for a deficiency in nerve energy in those areas. They have formerly been called parasite lines. We don't want to call them parasite lines anymore, because that tells us that that person has parasites in the moment. Actually, they are areas of genetic nerve deficiency where toxins cannot get out as well, nutrients cannot hold as well, and we know that parasites like to live on toxins. So this person that has these radial furrows can have parasites, and if they do, there will be things like rectal itching, or they will be nervous or anxious or have stomach cramps. So you want to ask questions of that person. When we see them up in the head area like this, we want to ask if they're having headaches or sinus congestion. When we see them in the lower region, such as the kidney reaction field, they may be having frequent bladder problems and going to the bathroom too often. So you want to look at where the radial furrows are located. There's a lack of nerve energy there. When they break through the collarette, that can irritate and cause even less of a lack of nerve energy, because the collarette represents the sympathetic and parasympathetic nervous system. Contraction furrows. Contraction furrows are very interesting signs, and those go in a circular fashion around the iris like grooves. And those are actually ditches that go around the iris and show that there is nerve deficiency, and these people tend to be anxious. They tend to have cramping. They tend to worry more than other people. These are genetic signs, and if these people will practice and learn to relax, they can have less problems with these. Contraction furrows are always a sign that the person needs more minerals. The funnel is an interesting sign, and here we see the funnel where the collarette actually breaks and moves out into an organ reaction field. And in this case, it's the reaction field of the uterus in a woman or the prostate area in a man. So when the collarette breaks, there's a potential for toxins seeping from the intestinal tract and affecting that organ just adjacent. The gateway arch or bridge actually looks like a little bridge. The collarette is raised above the iris. This is a genetic potential for hypoglycemia, diabetes, blood sugar disorders. If you see this sign, you want to ask people if they're craving sweets or if they feel shaky if they don't eat. Our next sign is called tophi. You might want to think about little tofu going around the iris of the eye, little blobs of tofu, or little sheep, little whitish, yellowish sheep. But these little tophi are actually collagen bundles, and they usually go around like a string of pearls in the iris of the eye. And those are a sign of potential lymphatic congestion, aching in the joints, sinus congestion. You want to look at the regions where they're located. The scurf rim. The scurf rim is out here in zone number 7. Remember, that is the zone of the skin. It is a dark rim that goes around in the skin reaction field, and it's dark because the fibers have separated to the posterior epithelial layer. Remember that density equals resistance, the ability of the body to resist toxins. So when it's deficient in this skin area, they have a tendency for acne, eczema, all kinds of skin disorders. The uric acid sign. So when we see this sign, this is when the tophi have moved in and they're thick like plaques, showing a genetic potential for uric acid. And you would ask a person if they have a lot of aching. Uric acid causes gout, gouty arthritis. It feels like sharp glass crystals in their feet and toes very often. The cholesterol ring. Here we see fat coming into the cornea. Remember, the cornea is like a clear glass dome on top of the iris. And here we see it whitening in those areas. And that's an area that we call the cholesterol ring. And that is a potential tendency for high cholesterol. We can even see fat in this area as well. The circulatory ring. This is a blue glow just outside the iris. It is actually in the sclera, or the white part of the iris. And when you see that blue glow, there's a possible problem with circulation, cold hands and feet. The blood is not getting to the extremities as well as it should. But that blue glow shows up when there is a possible congestion in the blood vessels. Remember, the outer edge of the iris is the large arterial circle where the blood vessels come together. The pinguecula. The pinguecula is a blob of fat that shows up in the outer sclera, outside of the iris. Here we have a blob of fat, and that's called a pinguecula. You can think of a little penguin under the snow to help you remember that term. But pinguecula means that there's a liver imbalance. The liver is not processing fats as well as it should. And it can show up near the canthus, which is near the nose, or it can show up on the other side of the iris as well. Now, there is a difference between a pterygium and a pinguecula. A pterygium is scar tissue that comes up over the iris, and it is filled with blood vessels. A pterygium can be caused by wind, sand, sun, a person stuck a pair of scissors in their eye. All kinds of things can cause a pterygium, but it's scar tissue. And when it comes too far up over the iris, it will cover the pupil. If it covers the pupil completely, they will go blind unless they have it removed surgically. Central heterochromia. That's when we see dark pigmentation in the center portion of the iris around the pupil. It simply means that there's extra color in the central area of the iris, showing that we should pay attention to that area and ask questions such as, do you have constipation? Do you have aching in your stomach? And particularly in this case, they have radial furrows, lack of nerve energy, which could cause cramping in those areas. Ferrum chromatose. Ferrum chromatose, ferrum, the term ferrum actually means iron. And ferrum chromatose means that there are tiger stripes going around the iris, looking like bands of pigment. And they can also be tiny little pigments going out in bands around the iris. But the term simply means that there is wear and tear on the liver, possible problems with iron absorption. They can have too much iron or not enough iron. So you want to discover if the person is tired and fatigued, which would be a sign of anemia. Pigments. We often see pigments in the iris of the eye, and these can be many different colors: brown, orange, rust color, golden colored, and even red, rust color. And pigments sit on top of the iris fibers. They are not crypts or lacuna, which are black and go into the iris fibers. They sit on top. And we're going to go into pigments very specifically later, but for now just know that they are melanin that sit on top of the iris fibers, asking us to pay attention to that organ area.